Hyperthyroidism is the topic, and hyperthyroidism is essentially a problem related to the thyroid gland producing excess thyroid hormone, and in particular T3 and T4. So a little bit of endocrinology for you. You have the pituitary gland that secretes TSH, that stands for thyroid stimulating hormone, and TSH then goes to stimulate the thyroid gland to produce two hormones, T4 and T3. And T4 is known as thyroxine, and T3 is known as triiodothyronine. Now a little bit about etiology. There are numerous causes of hyperthyroidism, but I will mention three of the most important. There's Graves' disease, which is the most common cause of hyperthyroidism. There's thyroiditis, and there's something known as a multinodular goiter. Now each of these has its own specific reason for causing hyperthyroidism, so I'll start with Graves' disease. In Graves' disease, what's happening is you have a stimulatory antibody, and this antibody goes and works on thyroid stimulating hormone, in particular the receptor that is in the pituitary. And this results in excessive stimulation of the thyroid gland to produce T4. Thyroiditis causes hyperthyroidism in a slightly different way. Itis should let you know that this is an inflammation, and when this inflammation of the thyroid gland happens, it causes destructive changes in the gland, and that leads to the release of stored hormone. So it's very important to remember that this is not a situation where the thyroid gland is producing excess hormone. It's just releasing the hormone that's already stored in the gland because of all this destruction and inflammation. And what's interesting is once all the stored hormone is released, later the patient can actually go into a state of hypothyroidism. And in terms of the multinodular goiter, that leads to hyperthyroidism because the TSH receptor gene has mutations, and that leads to thyroid activation. So they all have different ways of causing hyperthyroidism, but the end result is excess thyroid hormone. Now let's get into the signs and symptoms of hyperthyroidism. It's a very common medical disorder, so it's very important to recognize it when you are presented with it. First, I'll show a few physical exam findings. The first is some skin changes. You can have infiltrative dermopathy. You can have a skin condition called pretibial myxedema, and I'll show you a photo of that. Here are a couple photos of pretibial myxedema. You can see the characteristic erythema on the lower extremities, and you can also see some swelling as well. Patients can, although not always, present with a visible goiter in the neck, and here is a rather dramatic photo of a patient with a goiter. Another physical exam finding that is very important is exophthalmos. Exophthalmos is essentially referring to protrusion of the eyeball outward. So here's a photo of a patient that has what appears as unilateral exophthalmos. Only one eye is affected and the other eye looks relatively normal. So that is a very important physical exam finding in hyperthyroidism. The symptoms that the patient will complain about are nervousness, palpitations or tachycardia, increased sweating. Patient will complain of feeling hot, weight loss, and tremor. And there are several others, but I wanted you to focus on these ones as they are very characteristic of somebody who's suffering with hyperthyroidism. Diagnosis. Very important tests are TSH, thyroid stimulating hormone, and of course T4 and T3. Now, what will be the findings? T4 and T3, of course, will be high. TSH will be low, sometimes undetectable. Now, why is that? Well, if you remember, there's something called negative feedback. As the levels of T4 and T3 thyroid hormones produced by the thyroid gland rise, over time they tell the pituitary to shut down the production of TSH. And that's essentially the concept of negative feedback. So the T4 and T3 will be very high and TSH will be low. Other tests that you can do to help with your diagnosis is an EKG. And the reason is, in some patients that have hyperthyroidism, they can also present with atrial fibrillation. And this is commonly tested on licensing exams. And one final very important test I want to mention is something called a radioactive iodine uptake. What this involves is giving the patient radioactive iodine in the form of 123I, and this helps you differentiate different types of causes of hyperthyroidism. So for example, if the patient has Graves' disease, then the uptake by the thyroid is elevated. In contrast, if the cause of the hyperthyroidism was thyroiditis, then the radioactive iodine uptake is low. So please keep that test in mind. It's very important to differentiate between different causes of hyperthyroidism. Treatment. There's two main medications. There's methimazole and propylthiouracil, also abbreviated PTU. Both medications are fine. This one tends to be a little preferred if a patient is pregnant. Other medications that can be used are beta blockers, and the reason is because patients with hyperthyroidism can oftentimes present with a very rapid heart rate, tachycardia, so this will help alleviate the high heart rate that the patient has. A 25-year-old female who is 3 months postpartum presents with multiple complaints, including increased weakness, fatigue, intolerance to warm environments, a weight loss of 30 pounds despite an increased appetite, difficulty sleeping, awareness that her heart is beating faster and pounding in her chest, increasing restlessness and difficulty concentrating, increased tremulousness, and a significant swelling in her neck. She takes no meds, has experienced no recent trauma, and has not ingested large amounts of iodine. When you examine her, you find no exophthalmos or lid lag and no pretibial edema, but her skin is warm, smooth, and moist. You also find a smooth, non-nodular, non-tender, enlarged thyroid gland, clear lungs, and a resting tremor, and hyperactive reflexes. Lab tests reveal a low TSH and elevated free T4 and free T3, and high uptake on a radioactive iodine uptake scan. Which of the following is the most likely diagnosis? Well, all of these can cause hyperthyroidism, and that is the medical diagnosis she most likely has. So you have to figure out what is the cause in her case. Everything points to hyperthyroidism, but this particular finding leads you to think of Graves' disease, because that is the only one listed that has a high uptake on a radioactive iodine scan. All the rest will have a low uptake. So the answer to this is D. 37-year-old accountant is hospitalized for a laparoscopic cholecystectomy. The day after his surgery, he reports feeling palpitations in his chest. He says that even prior to his hospitalization, he had been feeling nervous and has noticed himself perspiring more easily. Past medical history is significant for a resection of a benign brain tumor during childhood. He also mentions that he may have lost weight, although he has not been dieting. Physical exam reveals a thin, anxious-appearing male. Lungs are clear. Cardiac auscultation demonstrates an irregular rhythm and no murmurs. Neurologic exam is significant for a fine tremor in both hands. EKG performed at bedside shows atrial fibrillation. The most appropriate study at this time to evaluate this patient's symptoms is. In questions like these, always go for the cheapest test first. And that way you can eliminate a lot of these even if you don't know the answer. But it's very clear he has hyperthyroidism. And hyperthyroidism is diagnosed by doing simple blood tests such as a TSH, thyroid stimulating hormone, and T4 and T3. So that would be choice D. And finally, a woman at 7 months gestation presents for a prenatal exam. She has a history of mild hyperthyroidism, and despite her advanced pregnancy, she is found to have lost 4 pounds since her last visit a month ago. She also has developed a fine tremor of her fingers. Her resting heart rate is 120 beats per minute, and her thyroid gland is noticeably larger than it was at the time of her last office visit. Management of this patient's condition would be best achieved by treatment with which of the following? This is a case of hyperthyroidism during pregnancy, and PTU is the drug of choice for that situation. So that would be choice D.